I was shocked but not surprised to read in the Ottawa Sun about a woman who has cancer and who needs chemotherapy, waiting for hours in the hospital, only to be ushered into what she thought was the broom closet. The article reads, Dana Whitman, who is undergoing chemotherapy for breast cancer, had been warned to go straight to the emergency if she developed a fever. She was even given a special fever card that is supposed to allow chemotherapy patients to jump the queue to avoid sitting in crowds in waiting rooms because they're so vulnerable to infection between rounds of the treatment. But that's not what happened when she went to Queensway Carleton Hospital's emergency room last week, feeling absolutely horrible and running a fever of 102 degrees Fahrenheit. In the midst of the ongoing overcrowding crisis, Whitman put on a face mask to protect herself and sat in the waiting room for 4.5 hours before she was taken into the emergency department. She was led past people lying on stretchers and taken to what appeared to be a storage room, she said. There were chairs, pillows, blankets stacked around her, and no bed. She said she felt like she was in a war zone. Yes, this is what our health care has come to, she said in a Facebook statement. This is the kind of story we should hear about an undeveloped nation, at which point we would get up on our high horse, all proud of the terrific system our citizens enjoy. But, and I'm sorry to say this, Canada's riding the short horse. I spent many years living in the USA, and one of the big surprises for me in coming back was to find that our substandard healthcare system is something so many people are fiercely proud of. But to be patriotically proud of something that is far short of the world-class healthcare a wealthy Western nation should be able to expect is dysfunctional. Dana Whitman had to wait for hours for care she was assured she needed right away.